in hearing this. And say your first name for me.
Kaya.
Kaya. That's Kalbach is a licensed psychologist at South Miami Hospital. She received her PhD in counseling psychology from the University of Miami, and during her training she worked with a variety of patients and clients, including oncology, patients and community mental health clinics, victims of trauma, university staff, and students. So that sort of covers the whole gamut, doesn't it? All kinds of things that you worked with. She's especially interested in medical psychology, health promotion behaviors, and the use of strength-oriented approaches to time-honored, how does that say? To time-limited. Oh, aren't we all time-limited? So you want to get health promotion in a time-limited way, and we were just talking about how do you really give good messages that people can hear and get. So she's a specialist in stress management, crisis intervention, dream interpretation. Now there's one for you. We can use that. And the psychology of eating behaviors. Listen, we can keep this woman here all day, right? In addition to her clinical practice, Dr. Kalbach has been an adjunct faculty member at the University of Miami and at Florida International University, and she is also a new mom, so she's learning a few new things herself. So welcome.
Well, good afternoon, everyone. Thank you so much for being here. We're going to talk a little bit about remembering and communication and gender differences therein. So this title was actually suggested to me by someone at Baptist Health when they wanted me to talk to a bunch of women who were coming for a spa day. And so I was given this title, Why Men Never Remember and Women Never Forget. But really, the truth of the matter is, it's more accurate to say why people never remember what we want them to know and why we don't forgive them when they make mistakes. But that's not as sexy of a title. And it's also really long. So the title remains Why Men Never Remember and Women Never Forget. Okay, so ask yourself, is selective memory a sex-linked trait? And it happens not to be true. What is interesting is what people remember and how it engages with them. And that's why we have selective remembering. Now, have you all ever learned when you took an intro to psychology class or something like that about people who have fantastic memories? There are people that just remember every single thing. They can literally look at a phone book for a few, maybe 1 or 2 minutes, and they will remember every name attached to every phone number and every address exactly correctly. Well, these people, you might think to yourself, they must have fantastic lives. They can remember any single thing at any given time. That must be amazing and fantastic for them. Actually, their levels of depression are higher. And that is because it's difficult to always have to know everything, to have to remember everything. Actually, forgetting is a very adaptive trait. If you remembered everything about this room and this space and this time, then you would have to remember that you can hear the light buzzing, or you can hear the traffic outside, or you notice that there's a 3-mile-per-hour breeze going on outside. All of these things can be exhausting to remember. So actually forgetting is helpful. And what motivates remembering and what motivates forgetting is our social and emotional knowledge about things. So selective memory is not a sex-linked trait. Remembering everything is hard. Women and men are likely to remember things, especially if they are scary or anger-provoking. Now, why is this the case? Why might it be helpful to remember things that are scary or angering? Yes, ma'am?
Do it again.
So we won't do it again.
Right, so we won't do it again. It's a very evolutionarily adaptive trait, right? If you remember that eating a particular plant gives you a bad taste, you're not going to eat that plant again. If you remember that when you walk by this particular part of the forest, there's a tiger there, you probably are not going to go to that part of the forest that often. So these things helped our ancestors survive and move forward and make their genes continue. So emotions are involved in memory, especially anger and fear. it is unfortunate for us as we look back over things that it's easier to remember things that are upsetting than it is to remember things that are really exciting or wonderful or gladdening. So you have to work to cultivate that, and I think that's what this whole gratitude movement is about, learning to remember that well. Okay, so the important thing to remember is that there are 5 main feelings in the world, okay? The 5 main feelings are glad, scared, sad, angry, and disgusted. Mad, glad, scared, sad, and disgusted. Those are the 5. Now, I didn't make these up. I didn't come up with this. People who are a lot smarter than me did that. Bless you. And actually, it was an anthropologist who went all over the world and examined the facial expressions of different cultures. Does anyone here watch the program Lie to Me? Has anyone ever seen that show? The guy who it's based on is this guy named Paul Ekman. And he did this research with a bunch of other people. They went around and sampled different facial expressions, and they came up with these 5 main feelings. So these are cross-gender, cross-cultural, they're cross-historically accurate. So what the 5 main feelings do is they key in to what our automatic and unconscious perceptions are. Now, this is important to know. If I told you that you were having the following physical sensations. Your heart is racing, you're noticing that you're sweating a little bit, you're breathing shallowly and rapidly, and you have a feeling of tingliness in your arms and legs. What would you say is happening? Panic? Okay, could it also be excitement? Right? Now, if I told you that you were having your first kiss with your big love of your life, you would say that would be excitement. If I told you that you were in a dangerous situation where you're almost hit by a car, that would be fear and panic, right? So a big part of our experience is how we perceive our environment. And we get environmental cues about that. We have our own social learning history that informs what we're perceiving. Because, for example, I don't know about you guys, but I love roller coasters. If you put me on a roller coaster, I'm the happiest person. I'm going to have all those experiences. My heart's going to race. I'm going to feel really excited. Now, you put the next person next to me who hates roller coasters, they're going to have all those same physical perceptions. They're going to interpret that as panic or fear. So, again, the same situation based on a person's own social learning history and their own personal individual differences can produce a different type of emotional experience. Nonetheless, these strong emotions motivate our remembering. They also motivate our behaviors. So, if we're feeling glad, what that's telling us is that something that we want to happen is happening, and then we're going to move toward that stimuli. So think about what happens when you're feeling glad. You hug, you move towards, you get excited, you engage with people, that sort of thing. When you're feeling scared, you're perceiving that there's a threat. And so you're going to do one of the 3 F's. Fight, flight, or freeze. Right? Have you ever been petrified with fear? Have you ever wanted to run away from something scary or fight something scary? These are all ingrained motivated behaviors that all of us have as human beings, and in many organisms as well, other mammals, even non-mammals. So the other emotion here that's next is anger. Anger tells us that you perceived an injustice. And the important thing to remember about anger is that it's not a bad emotion. A lot of people say, oh, I hate it when I'm angry, or I hate being around it, at the idea of anger. It's just really upsetting. I don't like it very much. But remember that a lot of our laws, our rules, the dictates of society are based on people getting angry about things and trying to fix a problem. So you can remember that each of these emotions are not good or bad. They're simply indicating to you a particular set of perceptions and motivating your behavior in one way or another. And we can learn to use our emotions as a tool for understanding ourselves and for knowing, about a particular situation and how we're perceiving that situation. When we feel sad, we're perceiving a loss. The loss can be big or little. You know, I have a cousin, her name is Leah. She wouldn't like to know that I tell this story because she's a very self-possessed 10-year-old now. But she used to be 2.5. And we did get ice cream together one time. And we went and we got ice cream. And she, you know, when you're a younger person in the world, your gross and fine motor skills are not as coordinated as they are maybe today. And so when she was licking the ice cream cone, I guess the ice cream parlor attendant didn't push the cone, the scoop down into the cone bear, and she licked it off. And this was a hugely saddening event for her. It was very, very saddening. She had this big loss. It was very upsetting and angering, so she had sad and anger all at the same time, and she really needed another scoop of ice cream. Now, if I experienced that, I would be somewhat sad, but then I would say, well, I just saved myself 120 calories. So, again, it's all about how, you know, you are experiencing it based on your own social learning history. Now, disgust is kind of a complicated emotion because sometimes we experience it externally, like that is something disgusting. If you see someone throw up, something like that, you know, we automatically understand that. But we also have self-disgust, disgust or repulsion that is aimed inward. And that can be very confusing for us because how do you escape from yourself? You're stuck with yourself. You can't escape from yourself. So for this reason, a lot of the times, you will remember those kinds of experiences very well. And that, again, has a protective advantage to you. You won't tend to do things that disgust you over and over again. And you will also avoid things that are dangerous. Okay, so again, emotions help add to the survival benefit of the species. If you didn't have any emotions to inform the way you were experiencing your world, then you would not know what to remember. We find this in folks that have had brain damage to especially the right side of the brain. What happens is they lose their social emotional knowledge. They can't decide what to remember because things aren't impacting them as well. So it's important to note that how you experience emotion informs what you will remember. And so for some people, this is part of the gender difference in remembering. Women tend to have more access to their emotional life and therefore will tend to remember things that they consider emotionally salient or present for them. So this is part of the little puzzle that we're piecing together today. Emotions also help communicate ideas and perceptions via nonverbal information to other people around us, right? So at least 65% of communication is nonverbal. A lot of our emotional life we wear on our face or in our body. So this informs people around us of what we are experiencing, what we're perceiving, and how we're moving forward. So again, without emotions, we wouldn't know how to prioritize our activities. Folks who have that part of their brain damaged, that many parts, the right side of the brain, they don't know how to take sequential steps to achieve a task because they've lost this sort of emotional, social knowledge. We would commit social missteps. We wouldn't know how to engage with people appropriately. We would struggle to decide which event to remember. Do I remember that I poured myself a glass of milk, or do I remember, you know, my 4-year-old telling a really funny joke? You know, what's the most important thing to remember here? If you don't have an emotional life to inform you of that, you wouldn't know what to prioritize on memory.
Is that a problem with autism too?
Well, right. So folks with
They can't do
autism
that.
have a lot of trouble with sequential planning. They also have trouble drawing themselves away from something that is repetitive. And they can also have a lot of difficulty interacting socially because they don't have access to their emotions a lot of the time. So that's part of the work with people when they have autism, is to understand these like very socially bound rules and cultural conventions.
Thank you.
Yes, that's a very good point. Women tend to pay more attention to emotions than do men. Again, so that's kind of how part of the title to this presentation today makes sense. Okay, so I'm not sure if you guys have ever heard of this guy, Mark Gungor, but if you haven't, Google him when you get home. He gives this really hysterical presentation on how men and women are different in their communications. And